Okay, so we have already completed the nephrology in the last portion. Vaccines has been also completed. So pediatrics का जो main portions था, almost all of those have been completed. It's now turn to do respiratory system. If you have not seen those videos, you can just go in the same playlist and find your videos and watch it. So this is respiratory system. So look, a 2-year-old female child was brought to a PHC with a history of cough and fever for 4 days. Okay, the child's age, the first thing you note in this question is child's age. Now she was brought to PHC, it does not matter. History of cough and fever for 4 days. The cough and fever is there for 4 days, and inability to drink for the last 12 hours means the child is severely malnourished. Or generally, if the child is unable to drink water, that means generally the child has severe malnutrition. ठीक है, the child has severe malnutrition. This we have already completed in our fluid and electrolyte topic कि अगर child is eager to drink means the child has some amount of dehydration. ठीक है, but if the child is not eager to drink or the child is unable to drink, the child is unable to drink means generally unable to drink, that means generally the child has severe malnutrition. Okay, so severe malnutrition is there. Next, there is on examination the child was having weight of 5 kg. Okay, respiratory rate of 45 per minute. So you have to mainly focus on this 45 per minute. So respiratory rate is 45 per minute with the fever. So the child will be classified according to IMNCI as suffering from. Look, the topic is very severe pneumonia, no pneumonia, and pneumonia. So how to diagnose this? Look, for this you have to take in account about the age, है ना? The age is required, plus the respiratory rate is required, and plus the malnutrition status is required. How to diagnose this? Look, I'll tell you everything about this. So look, this integrated management of childhood illness encompasses a holistic approach towards a sick child where criteria based diagnosis is made and treatment initiated as per the protocol. So the protocol says that if the age of the child is less than 2 months, if the age of the child is less than 2 months, the pneumonia will be diagnosed if the respiratory rate is greater than 60 breaths per minute. For a child between less than 2 months, for a child of less than 2 months age, the respiratory rate should be greater than 60 breaths per minute to diagnose the pneumonia. If the child is between the age of 2 to 12 months, means from 2 months to 1 year of age, you require at least greater than 50 breaths per minute. So next is greater than 1 year and between 5 years. So our child, the question which they are asking, the child is 2 years, so this is coming in this 1 to 5 years wala group. So this is generally greater than 40 breaths per minute. So greater than 40 breaths per minute is required to generally diagnose the pneumonia, है ना? Pneumonia is to diagnose the pneumonia, and here the child is 2 years age and the child has 45 breaths per minute, so pneumonia is diagnosed. So now let's see, the disease is classified as very severe if any of the following is present. Okay, so cyanosis, it is not given. Inability to drink or breastfeed, of course this is given. So any of the following is present, yes, this is present. So now pneumonia हमने ऊपर से diagnose कर लिया था, and now severe pneumonia का criteria भी generally it is filling. PEM, protein energy malnutrition, is also there. The disease is classified as severe pneumonia in presence of. The next thing that is there is chest indrawing, subcostal or intercostal recessions, use of accessory muscles of respiration like nasal fraining and generally sternomastoid prominent. So this is generally going towards our very severe pneumonia. You got it? How to diagnose this? Next, the following line diagram represents growth of the body organs with age. The growth of the body organs according to the age. So this is generally given a diagram here. You have to just see this diagram. यहाँ पे curve है, different types of curves are there. A, B, C and D. 4 curves are there. So for A you must remember this is lymphoid organ growth. ठीक है? For A lymphoid. B एकदम easy है. B for brain. Again C for generally musculo. So musculo में musculo, C is coming here, so this is generally musculo, and D में generally reproductive. So A for lymphoid, B for generally brain, C for your musculoskeletal, and D for your generally reproductive. Very easy to remember. So they have asked which of these curves will represent the lymphoid organ growth. So lymphoid is given by generally A here, so A will be our answer. It's very easy, nothing to do, just see once the curve. ठीक है? आगे देखो, a 5-month-old baby has a respiratory rate of 58 per minute and chest indrawing is there. The baby has not been able to feed for the last 10 hours. What is the best management? Again it is showing that the baby has generally severe malnutrition or severe dehydration. severe dehydration is present there. So what will be the management? They are asking what will be the management. So let's see the management plan. So generally here, if we see the different signs, then classify and management. If we do this, we'll be like we'll be able to do any questions from the pediatrics asked from this topic. So let's see the signs. General danger signs, that is inability to breastfeed or drink, lethargy or reduced level of consciousness or convulsions. These are generally the general danger signs. So this is generally present in this child. So this is classified as severe pneumonia. Okay, so this is classified as severe pneumonia, and we have already done the severe pneumonia case in the first question only. So management will be admit immediately. You have to admit immediately. Administer intravenous ampicillin or penicillin plus generally gentamicin. Give oxygen generally. Now give oxygen if saturation is less than 92% and manage airway as possible. So look, this chest in drawing with oxygen saturation less than 92% or SpO2 facilities is not available. So this is again the general danger signs. Next, fast breathing, that is respiratory rate 2 to 11 months में generally greater than 50 or greater than or equal to 50 per minute, and 12 to 59 months में generally greater than or equal to 40 minutes. So this is going towards generally pneumonia and or chest indrawing, that is SpO2 greater than or equal to 90%. Less than 92%, this is going towards very severe pneumonia, and pneumonia में generally chest indrawing is present plus less than greater than or equal to 92% SpO2 is present. Greater than or equal to generally 92%, that is generally pneumonia, and less than or equal to 92%, that is going towards your severe pneumonia. So here in this case you just see this 12 to 59 months में generally greater than or equal to 40 per minute है. So generally for this the treatment will be home treatment. Give amoxicillin for 5 days, soothe the throat and relieve cough with a safe remedy. That's all. And if there is no signs of severe pneumonia, or pneumonia, so this is going towards generally no pneumonia. So no pneumonia is present, and for this the treatment will be treat the high fever. If there is high fever, you just have to treat the symptomatic treatment you have to give. Treat which is present, assess regularly, and soothe the throat and relieve cough with safe remedy. Next, there is advise the mother when to return, follow up after 5 days if not improving, and if coughing or more than 14 days refer to the doctor for further investigation. If the child has wheezing, give 3 doses of inhaled salbutamol and reassess, and if there is no improvement in symptoms, classify as severe pneumonia or pneumonia. So this is generally the whole management plan for this pneumonia, severe pneumonia and no pneumonia cases. So here they have asked us, generally this is the case of severe pneumonia. So severe pneumonia you have to give first dose of generally ampicillin and gentamicin and refer urgently to the hospital. So this is the management here. You just have to take the diagnosis in here, and the diagnosis is severe pneumonia. आगे देखो, the comment on diagnosis based on the CXR findings. So this CXR findings यहाँ पे ये कुछ दिखा रहा है. So this is generally ये देखो all of these things, if you are able to see, this is nothing but the intestinal loops. These are the intestinal loops है ना, intestinal loops that have generally, these are being seen, the intestinal loops are being seen in the generally thoracic cavity. Actually intestinal loops are there in the abdominal cavity, but this intestinal loop has now migrated to the thoracic cavity. So this is nothing but generally intestinal loops in mediastinum, that is going towards your congenital diaphragmatic hernia, and this you have covered in your surgery topic also. Surgery में भी ये हमने किया, and very important question, how many times it has been asked in surgery also, in pediatric also, so many times it has been asked. So this is very important question. This is congenital diaphragmatic hernia. The 83% of the babies which CDH have defect on the left side. ये देखो right side, ये left side, and most of the babies, that is generally 83% of the total cases will be reported on the generally the left side of the generally thoracic cavity. आगे देखो, a 1.5-year-old child presents with single episode of wheeze and breathing difficulty. CXR is done and it shows bilateral hyperinflation, not inflammation, it is bilateral inflation. So bilateral hyperinflation, which organism is most commonly responsible? So look, bilateral hyperinflation plus generally wheezing, bilateral hyperinflation on generally the chest X-ray plus wheezing, this is generally going towards generally due to the airway narrowing. So there is airway narrowing, and this is, if the airway has been narrowed, so this is going towards your obstructive air disease. Obstructive air disease, that is nothing but the bronchiolitis caused by respiratory syncytial virus. Respiratory syncytial virus. So यहाँ पे देखो, this is going towards your RSV, respiratory syncytial virus. Next, this B and C, Streptococcus pneumonia and H influenza, these are generally auscultatory. Here, the auscultatory findings of the bronchial breathing or crepitations will be mentioned in these cases, Streptococcus pneumonia and Haemophilus influenza. If we talk about the Coxsackie virus, this will be generally causing hand, foot, mouth disease, that is Coxsackie A, and Coxsackie B will be causing myocarditis and fulminant and diabetes. So this is all about the other options provided here. Infant is admitted with respiratory distress and prolonged expiration with rhonchi in chests are heard. Very important thing, you must remember this. Rhonchi in chests are heard. CXR shows hyperinflation. Again, the CXR is showing hyperinflation. What is the diagnosis? This is again generally bronchiolitis. ऊपर में हमसे क्या पूछा गया था? Cause क्या है? The cause of generally the bronchiolitis is respiratory syncytial virus. So that we did the same question here. They are asking what is the diagnosis. So this is generally bronchiolitis. That is CXR shows bilateral hyperinflation. That is generally due to what? The airway narrowing, and airway narrowing which says that it is a obstructive airway disease, and that is going towards a bronchiolitis caused by the respiratory syncytial virus. So this is bronchiolitis. Pneumonia में क्या होगा? Bronchial breathing and crepitation will be heard. Again we did there. Crew में generally there will be hoarseness, seal-like barking cough, and inspiratory stridor, plus generally variable degree of respiratory distress will be present in the crew. You must remember this crew. ठीक है. Next there is asthma. Asthma में there will be episodic attacks on exposure to allergen. There will be an history of generally the exposure to allergens will be given. Which of the following clinical presentation is correct for a child with pneumonia? So a child with pneumonia, which of the following clinical presentation is correct? So child with pneumonia के लिए जनरली देयर विल बी लेस देन 50, नो, लेस देन 50 will not be there. with age of 2 months, no, we have already done कि 1 month old baby में greater than 16 breaths per minute होना चाहिए. 2 to 12 month old में generally greater than 50 or greater than or equal to 50 breaths per minute, and 12 to 60 month old में generally there will be 5 years to generally 1 year to 5 years there will be generally greater than 40 breaths per minute. So this is greater than 40 breaths per minute respiratory rate for 12 to 60 months. That is going towards your answer.